right now it looks like everyone is raring to go. So let's officially kick off our Maxicare Wellness Fridays. Welcome to Maxi Life Wellness Fridays featuring Crisis Collision, how to deal with suicide and COVID-19. My name is Patricia Bermudez Hizon. The COVID-19 pandemic can escalate a wave of anxiety and depression. If you are going through mental health and mental and emotional turmoil, know that you are not alone. Let's be there for each other and learn about suicide prevention in this session. It's time to meet our expert. Our speaker is an adult and addiction psychiatrist and one of Maxicare's mental health practitioners. She's a diplomat of the Specialty Board of Philippine Psychiatry, a consultant psychiatrist at esteemed medical facilities around the country, and she's an expert who will give us valuable insights on how to deal with suicide and COVID-19. What an honor it is to have Dr. Joyce Maglake with us this afternoon. Good afternoon, Dr. Joyce.
Good afternoon. Good afternoon, everyone.
Great to have you, Dr. Joyce. I'll let you have the screen because everyone is very eager to learn from you. Thanks so much in advance.
Okay. The suicide waltz. The suicide waltz is playing again. I never know when it will end. Is it certain or is it by chance that I am led to this tragic dance? As the waltz draws to an end, I leave a note to my dear friend. All I am asking is for some direction to deliver me from this insurrection. The poem we listen to describes how a person struggles with suicide as being an endless waltz, a battle for one's life. Despite the COVID-19 pandemic, suicide remains to be one of the leading cause of deaths over the past years. And yet it is something that is often misunderstood, repressed from memory, and misplaced as a character trait. So today, let us aim to understand what suicide really is, how we can help ourselves and others, especially during these trying times. Suicide is not a new phenomenon. Even prior to the pandemic, it has always appeared as one of the leading causes of death globally, with 2 to 4 deaths in every 100,000 as a result of suicide. In 2016, it was the second most common leading cause of death worldwide for both males and females aged 15 to 29. But suicide was not only seen in the younger population. It has been noted to be prevalent and is a lifetime risk for all ages. Last August 2020, a group of researchers here in the Philippines conducted a study among Filipinos where results showed significant levels of anxiety, depression, and stress due to lifestyle struggles because of the pandemic. A nationwide SWS survey also showed that stress has been increasing as the months of living in this pandemic persisted. This is despite us gradually going back to some semblance of our familiar normal. This shows that the psychological burden of this pandemic continues to weigh down on Filipinos. As COVID-19 continues to forge on and evolve, suicide rates have also reached a new high. The WHO now reports that it is in 1 in every 100 deaths. This is also seen locally as suicide rates in the country has increased by 57%. Why has suicide increased in such a way? In every pandemic and disaster, societies will always suffer a psychological impact. Pandemics bring numerous uncertainties and therefore threatens our very existence. We always live with the possibility of loss. Loss of livelihood, loss of our dreams, loss of plans, and loss of life itself. This heightens our stress and anxiety response. And this is something that all of us will experience. This is the psychological impact of a pandemic. History shows, however, that societies can bounce back. Seen on this slide is the typical social response of a community following a disaster. Eventually, a honeymoon stage is reached where communities will come together and build effective and lasting solutions. Unfortunately, due to the expeditious transmission and evolution of this novel coronavirus, social distancing and separation has persisted. It impaired this honeymoon stage in rebuilding communities. What is the effect of that? Well, studies show that when humans are in a chronic state of stress, functional IQ also declines to a more caveman type of thinking. In other words, we become more reactive, more impulsive, and easily distressed. This leads to an automatic survival mode wherein it is every man for themselves. We have a smaller sense of community. When we try to look for reason and attach ourselves on seemingly reasonable but definitely false information, we also regress. We look for coping behaviors that are quick fixes so that we can numb the pain in the moment without considering its lifelong negative impact on mental health and resilience. Truly, the pandemic has stripped humanity off of its familiar comfort and way of life. The WHO and CDC dub mental illness as the next inevitable pandemic. But to be honest, as how us psychiatrists are seeing it, it is concurrent with the spread of the virus. The psychosocial challenges of the pandemic has led to numerous vulnerabilities to suicide. Interpersonal psychology theorists describe that the feeling of isolation and suffering alone is further heightened by social factors such as unemployment, financial insecurity, bereavement, and if we get sick, being dependent on others for care. Cognitive behavioral psychology theorists identified that the psychological effect of the pandemic has brought about thoughts of hopelessness, helplessness, and cognitive distortions such as catastrophizing, magnification, for example, seeing discomfort as immediately symptoms of COVID, and mind reading and overthinking. For example, in the workplace, sometimes we experience this that whenever we have unanswered messages, there are always a snowball of thoughts about fears of our job security. The psychological strain translates chemically in our bodies as cortisol, which is the stress hormone. Its prolonged presence will lead to negative body-wide and system-wide changes, which makes us vulnerable to pathologies. In the brain, post-mortem studies of people who committed suicide showed decreased levels of serotonin. And this is something that happens in chronic stress, such as being in this pandemic. Serotonin is a regulatory chemical for neurogenesis or growth of our brain cells. It is important for regulation of mood, thoughts, and behavior. Suicide was also noted to have a genetic vulnerability with family history as an important predictor. So just like any other disorder, suicide is also a biopsychosocial phenomenon. Genetic vulnerabilities and psychological and social factors interact with each other and lead to changes in our body's biology. It leads to a hijack of our brain, and this is manifested by those suicidal thoughts. We humans are wired to survive. Therefore, it is counterintuitive for us to have suicidal thoughts. And their presence alone means that there's something wrong. So we should always see suicide as a medical emergency. Unfortunately, it is often misunderstood. Sometimes people think that it is a phase of teenage angst. However, suicide is not a normal developmental phase. A person who is often communicating about it is actually asking for help. People also associate suicide as exclusive to mental health problems. However, various illnesses may present with suicidal ideations even with people without any history of mental health problems. Any dysregulation or insult caused by chronic stress on the brain can make one present with suicidal ideations. In fact, there have been case reports of these among people who survived the severe form of COVID-19. I have actually encountered a case like this as well. They were noted to later present with psychotic symptoms, and unfortunately, there are some who committed suicide because of the psychosis. COVID-19's bodily effect really has a negative impact as well on our brain. Suicide is something that does not happen suddenly. It is common that prior to the attempt, there are several warning signs that precede it, such as changes in the person's baseline behavior. But most commonly, it is a verbal communication to a loved one. Unfortunately, it is taboo, so people don't like to talk about it. However, did you know that actually opening a conversation about suicide helps a suicidal person? It is even the main strategy for prevention. It is also not true that someone who is suicidal is determined to die. Majority of people who attempt suicide have mixed feelings. When someone intervenes, when the conversation is opened, the suicidal behavior is actually thwarted. So with this, since suicide is a global health crisis, let's also talk about ways on how to prevent it. The first thing we have to remember is that it is definitely preventable and it is an emergency. Therefore, intervention should always be sought. If you are having suicidal ideations, it is best to have a safety plan. These are just examples. One thing you can do is to not wait for its intensity to increase. Immediately grab your phone, talk to someone you trust. If you're alone, look for someone to stay with. If there's no one, kindly take a screenshot of the numbers listed here. These are our local suicide hotlines. As best as you can, try also to do the opposite of the thought, meaning try to look for an easy distraction, like watch a video of kittens. Do not drink alcohol or use any illicit substance. This will impair your judgment and impulse control. So try your best to take a step back and acknowledge that thoughts and emotions are waves. If these won't work, kindly go to the ER immediately. In fact, the Mental Health Act states that we don't need to have consent to bring someone in the ER for suicide. The best strategy, however, to prevent suicide is really to take care of ourselves. There is only one you in this world. Sometimes we don't appreciate it. We want to be someone else, or we want life to be another way. But the more that we fixate on that picture of how it should be, the more that we actually suffer. So let's try to extend compassion towards ourselves through RAIN. So first is R, recognize. Well-being is not equal to happiness. Okay? Happiness is a feeling. Well-being is achieved by being open to the fullness of life. It is recognizing what we cannot change, but focusing on what we can. A priest once said, if we live life focusing on what we do not have or on how things should be, it is a long list, and even in our death, that list is not yet complete. But if we focus on things that we can control in the present, it's a much shorter list and it leads to a meaningful life. Part of recognizing is accepting that this is how it is in the present moment. Acceptance is not being complacent, or it is not giving up. It's the opposite. When you accept, that is actually the first step for you to figure out a meaningful response. This is why the phrase, it's okay to not be okay, gained popularity, but it is often misinterpreted. Let me tell you what this phrase really means. It means that your thoughts, emotions, circumstances, they are not everlasting. So it is okay if in the present we don't feel all that fine and dandy. But for us to move forward, we have to accept and allow, understand it by taking a pause and then trying to turn on an observer mode. Okay, so it's important for us to take a pause and try to investigate and understand what these feelings are actually stating. Did you know that that actually leads to dramatic effects on our brain? Tibetan monks who meditate for 15 years were noted to have more capacity to regulate their emotions compared to those who do not meditate, or the non-monks. However, those who practiced mindfulness even for just 5 minutes each day were noted to assume the same brain regulation as Tibetan monks. So before you react, before we go to social media or vent with each other, try to take a pause first. Let yourself stop literally first and let the emotion sink in, because it is like a wave. Next is I, investigate. You know, it is easy for us to be supportive of others, but difficult to show compassion towards ourselves. Oftentimes, we use pressure to motivate us, but life is already full of pressure and we don't need to add to it. Hence, try to investigate with kindness. You understand your context the same way as how you would support if this was happening to your friend. For example, being unable to cope in the pandemic is a shared experience. So it's about looking at our inner self, our emotions as friends with messages, and we can decipher and comfort it. So before we move to the next step, let me just invite all of you to just do a little activity with me, just for a minute. Okay? If it is okay, just try to close your eyes. And as you do, put your right hand over your left chest. Just allow your attention to focus on this, the sensation of your palm on your chest. Notice the warmth of your palm on your chest. And then bring attention to how your heart beats. Continue to follow your heart beating. There's a message here. The message is actually, this heart is beating because you have purpose. Now open your eyes. There's only one you in this world, and within all of us is inherent wisdom and beauty. But to find it, we really have to take care of ourselves, both mentally and physically. When we do that, we take care of our body. Always take time to pause and balance the day before you sleep. The moment you wake up, Remind yourself that life is a process. You can do this by adapting a beginner's mind, where things are to be learned. There's no such thing as a failure or mistake, but it's about learning, since we are all students in the school of life. When we are compassionate towards ourselves, this serves as a blueprint on how we can be compassionate towards others. For those of you here who are executives or managers or even just part of a team, always remember that right now it is important for us to promote a culture of empathy and compassion. Include suicide awareness in your workshops, in your town halls. Include it as well in your safety protocol. Just as how we have protocols for disasters like fire, earthquake, include suicide there. Have counselors in your employee assistance programs. There are also little ways on how we can extend compassion to prevent the someone from committing suicide. For example, having a clear cut working schedule. A lot of people right now are suffering through the work from home environment because of blurring of work hours. It's also important for us to still practice prioritization labels and techniques that we had prior to the pandemic. And most importantly, the need to transform our culture to keep up with the times. Part of this is destigmatizing stress. Stress is not a character trait, but it is a symptom. So usually it means that we have to investigate what's making people stressed out. So how do we support someone who is suicidal? Again, remember that the conversation about suicide is life-saving. It is always important to be open, okay? So these are examples. You can say, I've been concerned about you lately. I wanted to check in with you because I noticed parang nalilate ka, hindi ka usually ganon. Concerned ako sa'yo kasi kaibigan kita. Okay? Always start with that intention, okay, so that they know that it is there for concern, right? And then keep the conversation open, meaning we ask open-ended questions. When did you begin feeling this way? Do not say, okay, you're not thinking of suicide, are you? Don't do something stupid, okay? Don't say those. Judgment is the one that inhibits the help-seeking behavior of people who are suicidal. So don't say those. Again, remember, when we open the conversation, when we don't consider it as taboo, then people would also want to talk to us. So sometimes you can say, sometimes people who feel down start to contemplate about suicide. Have you thinking about it as well? Okay, so you can try to ask it that way. You're going through a lot of pain, and I may not have all the answers, but you're important to me, and it's important for us to get help. Do not say, tell me what's bothering you, and I'll keep it a secret. Never ever keep it a secret. Always remember it is an emergency. The mental health law indicates that. So you can say, I understand it may be awkward to talk, or perhaps consulting with a professional can help. Gusto mo, samahan kita. Don't invite them as well to drink their troubles away. This will impair judgment and impulse control. So what you want to do is to help assess the safety of their environment. So you can just ask, I'm concerned about your safety. Are there weapons, firearms, or substances in your house? You can also say, please promise me that you would refrain from drinking alcohol until we see a professional. And you can also ask if there is someone there with them right now. So as you can see, it's really about allowing them to talk and then later on having that safety plan. I know it can seem daunting, but to be honest, even us psychiatrists don't have the magic words to say. It's actually not about that, but it is about your ability to be open and to listen. When we are open, when we fully engage and actively listen to the person without any judgment, and they will see that, no? Our true intentions, no judgment, all compassion, it is actually that which saves the person. So that's the end of my talk. So thank you very much. And I hope that you were able to gain something.
Oh, absolutely. This is so precious. Thank you so much, Doc Joyce. Great learning, absolutely. And we appreciate your time and your expertise in this topic. I'm sure our Maxicare members also learned so much valuable information from you. Again, for this session, feel comfortable to ask your question privately using the chat box. Your question will be sent to the panelists only and will not be seen by the others. So now allow me to introduce another expert who will now facilitate the Q&A. He is a fellow of the Philippine Psychiatric Association and the Philippine Association for Child and Adolescent Psychiatry, and a consultant psychiatrist at the Medical City. Happy to have with us here Dr. Kenneth Havate.
Hello and good afternoon. Thanks for the kind invitation, introduction, and thank you for that kind invitation. I'm happy to be with everybody here today, to be with you during World Suicide Prevention Day to talk about this topic. And I am happy that I am with my friend, Dr. Joyce Maglake. And Joyce, I'm really grateful. I learned a lot from your talk, even if I am already a psychiatrist myself. I'm really appreciate the fact that you really highlighted how suicide has always been a problem, but the stress of COVID-19, the isolation, the uncertainty has really leveled up our collective and individual experience of stress. So it's overwhelmed our coping strategies, such that I guess it's not a surprise that suicidal thoughts and actions to harm oneself and the consequence of that are on the rise. I do appreciate about how there's a lot of stigma about mental health that we do need to work on, and that there are so many myths about it, and it's great that you dispelled that with the facts. And that finally, I love that you did focus on preventative actions, given our understanding of what it is. Actions that we can do towards others, the people that we care for, the people that we're responsible for, whether at work or in other settings. But I think it's good. I really appreciate how you brought it down to the level of the self. Suicide prevention starts with ourselves and how we take care of ourselves amidst this stress. And I guess there are so many questions, but I want to put in my own question first. Because, as you know, I'm a child psychiatrist, Joyce, and I guess I work with a lot of young people, and I guess with it's not just maybe influenced by media. It's not uncommon for me to, work with young people. And I'm so stressed, I want to die. This is something that parents tend to ask me. But like for you, are all suicidal statements created equal? For you, is there how do you determine if it's serious or should everything be parang already a cause for alarm in the same on the same level?
Right. Thank you so much for that question. Yes, that is the complications of this. There are sometimes it is an expression that people sometimes do, but I think what is important is to see the suicidal behavior as a symptom. So, for example, if we see it with changes in behavior like depression, not going to school for the kids, suddenly isolating themselves, and then the persistence as well of the thought, I think that is what will separate it from that expression of teens, or that a millennial expression, if that's what it is, from the actual cry for help. So we have to look at the context or the person as a whole.
Exactly. Totally agree. That makes sense. No? It's really putting it in context. It doesn't come out not just in a vacuum, but in terms of the entirety of the person's experience, right? So let's move on to there. We have a lot of questions from the audience, and this might be similar. The person who asked this says, how do you determine if your acts or thoughts are suicidal? So I tend to overwork or do extreme workout to experience physical pain because it somehow eases that void deep within. So
Mm.
that's what he said.
Right. I think when we usually talk about suicide, there's also the self-harm aspect, which I didn't really touch on because I wanted to focus on suicide itself. But there are also acts wherein sometimes that's our tendency, just to numb the pain, we will actually do self-harming behavior. So maybe it's not that intention in such a way that it is clearly stated that I want to die, but the form of doing things to our body to hurt it, to feel something, or sometimes it's to actually numb your emotions. I think that
Mhm.
is still something, a cause of concern. So it is something that's good to talk about because, again, it's counterintuitive really for us to be quite harmful towards ourselves since we're always geared, supposedly our DNA is geared towards survival. So when we start doing those behaviors, it means there's really something pain that's causing us pain, and the best way to handle it is to talk about it.
Right, right. Because probably, I guess, from this person, what he's saying is that he's using another sort of pain to distract himself from the
Right.
pain within. No? But
Within.
it's finding, I guess, you're right, like finding better. I mean, from I tell my patients at the end of the day, sometimes I think those thoughts are in some way, I mean, coping mechanism in the sense that they don't have any other coping mechanisms that they
Right.
can use. But there are coping mechanisms that make you maybe distract you or make you feel better for a little while, but then and it doesn't really solve the problem. I mean,
It's
and
still
that's
there.
self-harm, right?
Yes.
And hurting oneself. And then maybe it's, as you said, talking can lead to a conversation that can lead to better coping mechanisms. So right, okay. So this other one, some recounting the experiences of one's friend, no. So the question goes: yesterday, a friend posted on Facebook that he has suicidal thoughts. There have been previous posts in the past few weeks saying that he is really having a challenging time. And I checked his account today. Oh gosh, and he deleted all of his photos and posts except for his suicidal post yesterday. We are very worried. What is the best step for us to reach out to him if he is not responding to our comments and messages? Thank you.
Mhm. Usually, I think again, it's good that you are engaging with your friend. The conversation helps, but I think this time you can also tap to other people with your friend. So if your friend is not responding, perhaps try looking for their family.
Mhm.
If their family is there, or maybe like a wellness check if that's possible, asking for a relative or someone to check on them,
Mhm.
just to make sure that they are safe and okay. And then, if it is really indicated, even when you see them, I guess perhaps also going to the hospital if you feel like it is indicated, especially since you've lost contact with your friend.
That's a good choice. I think a lot of people there, of course, want to be sensitive and want to respect the privacy of the person. But I always tell some of when my patients or their families, when it comes to questions of one's safety, safety is more important than confidentiality,
Yes,
right?
yes. That's
So,
the reason why
oh,
the Mental Health Act really states it there, no, na harm to self, uh, you
mhm.
don't need any consent really for that because it's an emergency.
Exactly. So we do have, when it comes to lives, we place primacy on that. All right. So I have a set of questions that have a similar theme. So I'll read both of them. So are there suicidal persons who do not verbalize seeking help? How do we recognize that? No? And in relation to this, so another attendee recounts, my cousin recently committed suicide. Why is it that there were no signs or noticeable change in behavior prior to taking his life? Why are there no changes? Even his parents do not have any idea that he's going through something. Mhm. So yeah, very very challenging because
Yeah, very difficult
it's
question.
obviously parang cause yeah, caught them by surprise.
Yeah. Yeah. And this is also the thing which is why I'm not sure if we noticed, but that's the reason why I always refer to suicidality as a symptom, because that's what it is. No? It is a symptom. A lot of things manifest with suicidal ideations. So this is probably why sometimes there will be, I guess, nuances from what we usually what I presented as well. For example, maybe when a person doesn't talk with us, it's probably because they're also still sort of like, managing it in their heads, or maybe it's also difficult for them to accept that they have those thoughts, which is why one of the best ways to start the conversation is to open up first with your intention. For example,
Mm-hmm.
saying na, let's say, for example, with Dr. Havate, I'll say, Ken, you're a very important friend to me. I noticed lately, blah, blah, blah. So that's how you can open the conversation. Now,
Right.
for the other one, yes, sometimes that does happen. Maybe like there is a lot of, not all the time people would actually be open about it. But just remember that having that, destigmatizing it, meaning, making it a non-taboo, just even randomly, just really opening up the conversation about it, would actually help, so that when people would start having those thoughts, they can start, they would know that they can talk to you without any judgment.
Right. And that's really the problem with stigma about mental health, no? A lot of people are afraid to verbalize. I mean, these difficult thoughts. So, I mean, that's why I think even talking about um, parang not being okay or even being suicidal should be stigmatized, because otherwise, yeah, we have this no verbal, parang no clues, no, whether direct or indirect, no.
Right.
And it sometimes it's only after a while where you realize, oh, there were these parang subtle behaviors, or maybe because of this change in situational, that's probably a clue. But like if there was less stigma and greater sensitivity and to ask the questions,
Right.
then that might be
Yeah.
that I mean that might be one way. But of course, each complex, each case is very very complex, and
That's right.
I cannot begin to imagine. I mean, how challenging those experiences for those who answer the question
Right.
must have been. No, okay,
Sorry, if it's okay to
yeah.
add, that's why maybe like for example with
Mm-mm.
companies, schools, it's one way for us to destigmatize is to really talk about it. So WHO, for example, has a suicide awareness month. Let's
Mm-hmm.
celebrate that, no? Meaning, let's talk about it, let's have workshops about
Mm-mm.
it. Sometimes what makes people clam up is really that stigma. What will people
Right.
think? What will they
Exactly.
say? So not
Right.
wanting to disappoint, sometimes that's the one that causes people to clam up. So let's
Yeah.
open the conversation about it really.
Right. And I'm so glad, Yun. I think that's why everybody who is here should really give themselves a pat on the back, because this is not an easy topic. I think to even just listen, like even put even think about. So, but it reflects that openness, and I hope that just by being here, uh, we are talking about it, and hopefully this can translate into our lives after this session ends. No, so you talked about stress, Joyce, and we have an attendee who is asking about the pressure. Sabi niya, how do you regulate the pressure you put on yourself? No? Or how do you know that this is still a healthy pressure you're giving yourself for you to accomplish things? Hmm.
Hmm. Right. That's a good question, because I think that's something a lot of us are probably going through. We always grew up with this idea of having to pressure ourselves to perform.
Mm-hmm.
So I really think what is important is, well, that's also the reason why I chose RAIN. No?
Mm-hmm.
Recognize, accept, investigate with kindness, and nourish ourselves with compassion. Sometimes we have to sort of really take that observer mode and kind of like ask ourselves that question na, if we're working for how do we appraise ourselves? Not is it always about outcomes,
Mm-hmm.
or is it also about
Hmm.
just acknowledging that um there's no condition about ourselves, whether or not we achieve something. This is just one life that we have, so we don't have to prove anything or base our self-worth on external factors. So having
Mm-hmm.
said that, this is the reason why the how to help ourselves, for example, if that's how when we pressure ourselves or that relationship with ourselves, it's actually a commitment as well that we have to pursue.
Mm-hmm.
Mental
Right.
health is not automatic, no? So we have to do practices to actually build a relationship with ourselves. Sometimes I tell my patient, how much you courted your partner, you have to also court yourself. You have to do it. You have to date yourself. You have to spend time with yourself. So I'll leave it at that. Maybe for the person who asked that question, have a one-on-one time with yourself later, and then maybe try to ask yourself, like, how do you really feel about yourself? And then try, if you are being hard on yourself, try to ask why. You know,
Right.
what's making me hard on myself, or when will I be enough? Because I'm sure you're already enough.
Great advice, Joyce. No? I mean, as I know, a guru parang famously says, if you can't love yourself, how are you gonna love somebody else, right?
Yes, our favorite guru.
All right. Okay. So okay, this is another set of, I think, related questions. So, and I think this is relevant. It speaks to maybe our profession. I don't know. We maybe have some work to do because so this attendee says, and this is the first part. The first question: I feel fear when thinking of reaching out to a professional. What should I do?
Oh
Right,
no.
and this is another question related to that, but a separate person who asked, no, how can oneself prevent the heightened suicidal ideations if they feel awkward saying it to their psychologist or psychiatrist? Hmm.
Oh my. You're right, Dr. Habaden. Maybe it's there's also the impression of seeing us. I think maybe that's when we have if we have a psychiatrist or a psychologist, and then there's hesitation for us to share. To be honest, usually I would encourage you to bring that up with your therapist. No, we have what we call goodness of fit. So when we say goodness of it, you don't have to force yourself into this relationship with your
Mhm.
psychiatrist or your psychologist. You can look for people whom you know that whom you feel at ease talking with. I have patients, they don't like talking to older professionals because it
Right.
reminds them of the people who trigger them. So it's difficult for them to say suicidality. So sometimes they would prefer someone younger. There's also a reverse, like they want like a lolo version, like a comforting lolo, so that would work for them. So it's great that you have a therapist or a psychiatrist or a psychologist, but you also, as a patient, you also have the power to choose, no? As what
Mhm.
our hospital says, patients are partners, so you don't have to lock in yourself with them. Having said that, though, I do want to say that as psychiatrists, the mental health professions, the first thing we are non-judgmental. No? Well, at least I'm sure Dr. Havate and I are not. So it's there are if there is that difficulty in communicating about suicidality, maybe it's not just there's really like an improvement with the relationship that needs to happen with your therapist. But to be honest, when we also open up to them, sometimes that's the first step also that would actually help break that wall,
Yeah.
and
Yeah.
it would lead towards treatment, because sometimes we also stigmatize that thought, kaya natatakot
Right.
tayo to say. So it's that, no, parang first look at how comfortable you are with them, and then also investigate if is it like a personal thing na nahihiya ako, I don't want to disappoint them, parang
Mhm.
ganon, or
Mhm.
it's like
Yeah.
something na I'm still struggling with accepting as
Yeah.
well.
I mean, it's very sage advice. Goodness of it is important. And I just, I think for everyone to remind, I mean, I think this is kind of a situation, especially some of my patients, I notice I guess they're very nice. They're very kind to other people, and sometimes at the expense to themselves. So they have these habits where they really automatically think of the other person's parang before themselves. But and I think this is why some of my I've had been in these situations where like they might I sense that they feel pressured to say the right thing,
Yeah.
right?
Yes.
But I told them uh what I tell my and when I'm in that situation, what I try to tell them, it is it is my job to make you comfortable. It is not your job to make me comfortable.
That's
Right?
right.
If you have something to say that makes you uncomfortable, that is helpful, because that will give me information that will help you better. Right?
Right.
So it is, it's the burden is on us, the professional.
That's
So I
right.
hope
That's right.
that's something that people keep in mind, because getting to a health, I sabihin man natin, goodness of it, I know it's hard to get an appointment. There's not a lot of mental health professionals out there, but so keep that in mind, no? Okay, so I think, well, it is 5:55. There's so many more questions, to be honest, but I understand that we do have to wrap up soon. So, well, I guess we will. There's we might end up with a very one, but this is, I'm just following the order, but this is a tough one. Okay, so prepare, Joyce. No, so I don't think this was answered. No? So sabi nga, so sorry if this was already answered, but may I kindly ask, how do we resolve the problem when that we no longer have any will to live?
Right. Yes, you're right, Dr. Habate. No, that's a really tough question.
That's a tough
But
question.
that is a struggle. That's the reason also why I started with the poem. That poem was created by a patient. Because that's the struggle talaga with suicide. No? And it's so hurtful when people see it as a character trait. Na this is, ganyan yung person na yan. Even us, stigmatizing ourselves sometimes. To be honest, I don't know how to answer that question. But what
Mhm.
I will say is that um, as we went through the journey of psychiatry, one of the things that really kept me in this field is because of wonder. No? I saw na sometimes there's a lot of pressure for us to be a certain way, but then what will actually help us live our best life is actually just being ourselves. But it's difficult because we live in a world full of judgment. So that was the inspiration that got me to continue with psychiatry, because of course there were times when you don't want to because I want people to know that they don't have to look for a reason. They're
Yeah.
reason themselves. And to that person that asked that question, sometimes we don't have the answers
Yeah.
at the present, but sometimes the mere fact that you're still here, your heart is still beating, there's still a lot of things to unfold in your life. And if there's anything, just remember that there are a lot of things to still unfold in your life, and they're all there for you. So maybe we can end also with that sentiment na,
Yeah.
especially in this pandemic, it has stripped us a lot of things. It's so difficult to really hang on to things. It's a shared suffering. It's a
Yep.
shared experience. There's no coping manual on life.
No.
There's none. But
Mhm.
the more that we also struggle on how things should be, the more that we will also suffer, the more that we will be led astray. So just believe in yourself and just focus on yourself. be your genuine self, and you will determine that answer and that purpose.
All right. And very well said, Joyce. And I think I definitely echo that sentiment. And with that, it was really my privilege to be with you here to talk about and to join the conversation with all of our attendees today, and to ask about this fair and to be able to discuss these very, very relevant questions. So, mhm.
I'm glad
Right.
to be here discussing this difficult topic with a very dear friend. Thank you, Dr. Abate.
All right.
Well, thank you both, Dr. Joyce and Dr. Kenneth. I know, Dr. Joyce, you need to jump to another engagement, and we really appreciate everything. Thank you, Dr. Joyce Maglake.
You.
And since we still have Dr. Kenneth with us just for a few more minutes, Dr. Kenneth, I know that
Yeah.
this has been a really heavy topic, but of course, as
Yeah.
an expert yourself, I'd also like to get maybe your final message for our
Right.
Maxicare members, and maybe synthesize all of the learnings that we've had here.
Yeah. Again, thank you everybody for being here. Obviously, this is a very challenging and difficult topic, but I guess challenging and challenges and difficulty are actually what help us grow. I mean, in some of my talks, I don't know if people are familiar with this Japanese art called kintsugi. It's like you've seen might have seen pictures like these pots or vases, like they've been broken, and then what will happen is that they've been put together again, no, but instead of like hiding the scars like in the ceramics, but actually the artist will highlight them, with gold paint. So actually it comes back more parang beautiful. So I think the struggles that people are going through, uh, I mean, it's why, and life is hard nowadays. That's why no wonder the thoughts of ending one's life, just escaping away from it all. Admittedly, I can't blame people when they come to my clinic, and they have those thoughts. But I guess the promise is that, like, coming from that, like that art, no, opportunities in which we are broken are opportunities to piece oneself back together, to rebuild. And as with that, that art, you come back stronger, more precious, more beautiful than before. And I hope, amidst these difficult times, that's something that people can keep in mind, despite, even a person who has gone through rock bottom, has already committed, done harm to himself or herself. There's still an opportunity to rebuild, and let's not lose sight of that.
Wow, thank you so much for that message that's just full of hope and full of wisdom. Thank you so much, Dr. Ken. All right. Well, that was such a wonderful experience for all of you Maxicare members that came here today. I'm sure you all appreciate that. To our attendees, thank you so much for participating in the Q&A and being so engaged throughout the event. I see that there are still so many personal questions that people have asked about their own mental health and their own mental health journey. It's just great that Maxicare is the first HMO to offer mental health services in their primary care centers. So if you'd like to know more, please coordinate with your designated health benefit executive in your company regarding your inquiry, and they can take you through that and connect you, of course, with Maxicare regarding this benefit. Now, to our Maxicare members, can we invite you to please take a few moments to answer a feedback form after this event? Here's the link on the chat and the QR code on your screens that we're sharing right now. Of course, your feedback would be most appreciated. Right now, we will be announcing the winners of our raffle draw, and the winners were randomly selected by our staff amongst those who share their most memorable Wellness Fridays event or topic. Now, for those who I will be announcing, please chat also additional details about yourselves, including your company details. We would appreciate that. But just as a reminder, we do have a winner for a laptop bag, one who will get a foldable umbrella, and another one who will get a chance, or who will get not just a chance, but definitely get a mini clutch bag. So let us flash the names of those winners, and the Maxicare team will get in touch with you. Marivon Grace Vinluan, congratulations. Pamela Montesa, congratulations to you. And Rochelle Ubias, you get the mini clutch bag, while Pamela gets the umbrella, very helpful. And Marian will get the leather laptop bag. And like I mentioned, to our 3 winners, please share with us your information and the companies that you represent. Congratulations. Now, before you guys go, we still have a couple of more poll questions. Now, just click on the answer that best suits you. Shall we launch it? Here is the first poll question. Which topics or activities would you like to see in future Wellness Fridays events? How COVID-19 affects children, and this is so timely. I have a baby myself. Blood disorder types and treatments, breast cancer awareness, achieving healthy weight, or productivity hacks for work from home employees. Such great and interesting topics. Let's see which ones you guys will select, and we will do our best. A lot of people, just like myself, I was thinking that too. Productivity hacks for work from home employees, and just as important to them is achieving healthy weight, and of course how COVID-19 affects children. Thanks so much for sharing your insights. I got 2 more questions. Now here's the next one. On a scale of 1 to 5, 5 being the most, how do you think this webinar will help you live your best life? Now, if you give us your answers, you can go directly to the second one as you scroll down on the poll, because the second question is also being shared right now, and it goes on a scale of 1 to 5 also, 5 being the most. How likely are you to recommend the next event to others? Of course, we would like to know what you guys think. I need not share what you guys think about this event. I can see with the amount of engagement that we got here, the questions, the insights, and even some of the sharings of appreciation that you had for this event really is a telltale sign that this is something that was really important to all of you. So thank you so much in advance. Now, if you guys enjoyed this experience, please do share it on your social media using the hashtag Live Your Best Life and the hashtag Maxicare Wellness Fridays. And please do tag Maxicare on Facebook at Maxicare Healthcare Corp. Their IG is at Maxicare Healthcare, and the Health and Wellness IG is at Maxicare Health and Wellness. Of course, you tag them when you share about your wonderful takeaways about this event, especially in this particular series. Maybe you guys will be able to help other people have a better appreciation for mental health. Now, don't forget to subscribe also to their YouTube channel, and that's Maxicare Healthcare Corporation. To know more about Maxicare's products, please visit www.shop.maxicare.com.ph, or you can send them a message through their FB Messenger. You can also email them when you have questions about Maxicare's Wellness Fridays events. You can email them at maxicarewebinar@maxicare.com.ph. Now we will have another great Maxicare Wellness Fridays event, which will be on September 17th. We'll see you guys then at 5 p.m. And this is when we get to talk about COVID-19 in children. Perfect. I want to be there, and of course you guys will need to be there as well. And this is going to be with Dr. Anna Lisa Ong Lim, a great expert. The QR code for the registration will be flashed on your screens right now, and make sure you guys register early. That ends our event for today. Thank you so much for being with us this evening. We really appreciate the time that you spent. We hope that you enjoyed it and you were able to take away meaningful information. Thanks again, everyone. Have a great night. And we know that with Maxicare, they really care and they really want you to live your best life.